Welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Gladwell Dental.
On today's episode, Dr. Muresan's got a case for us where her patient had some aging veneers. Tooth number 9 had a crown that was showing some gray due to previous root canal therapy. And there was some chipping and they weren't blending well. They were showing their age.
Exactly. And I had the opportunity to assist Dr. Muresan with this case. So I can tell you firsthand, the most nerve-wracking thing to do in dentistry is take off someone else's old units. You just never know what you're going to find underneath.
It's like
this is what
Forrest Gump.
Exactly.
Box of chocolates.
Box of chocolates.
So she temporizes with Biotem's Provisionals, and then she restores with BruxZir Aesthetic restorations.
Right, and the provisional stage played a key role in this treatment, and you're about to see why.
Let's check it out.
In today's clinical case, I am presenting BruxZir Aesthetic solid zirconia material I use to restore teeth 4 to 13 using a combination of crowns and veneers. At the end of this case, you will see how this material transforms a patient's smile from chipped and dark to beautiful and bright. This patient expressed great dissatisfaction with the appearance of her smile, especially the existing crown on tooth number 9, which did not blend well with the surrounding restorations. The patient had PFMs on teeth 4 and 5, IPS Emax veneers on teeth 6 through 8, 10, 11, and IPS Emax crown on tooth number 9. The previous veneers, especially number 8, were fractured and chipped. Considering that these veneers were bonded to enamel because there were no prep, it's likely that they failed due to the weakness of the ceramic material and not due to the lack of enamel present. BruxZir Aesthetic restorations are an ideal solution for this case because they have an average fractural strength of 870 megapascals, representing a substantial increase in durability over other anterior grade solutions. These pre-existing veneers were all no-prep veneers and had lost their marginal integrity, so I expected to have some exposed dentin in some areas after removing the caries. My preference, when I have exposed dentin and more than 50% of enamel is gone, is to go to a material that has high flexural toughness such as BruxZir Aesthetic Vivaneer, which was an excellent option for this patient. After removing the previous crowns on tooth number 9 and all remaining PFMs and veneers, we can see significant marginal leakage and caries that needed to be eliminated. But I was happy to see that some of the underlying enamel was still intact. Patient's tooth number 9 had been previously treated with a root canal therapy and featured a dark discoloration. Tooth number 9 was cleaned and rebuilt up to proper form using a dual-cure reinforced core material. Before planning a case, it is important for me that I understand the end result desired by the patient. In this case, the patient wanted a very light shade. This required that I will take her from the existing 3M3 shade to a OM1 bleaching shade on the Vita 3D Master. To ensure that the dark shade would not show through the restoration, I use external bleaching to eliminate the dark cervical on number 9 and also to whiten her lower teeth. I also use pink opaquer from Cosmodent. After completing the external bleaching, the patient was provisionalized with Biotem's temporary restorations. Biotem provisionals are patient-specific temporaries. Their morphology more accurately matches that of the final restoration and is helping to shape the gingiva so there will be no surprises at the patient's final visit. I can use these provisionals to train the gingiva after the gingivectomy I perform above 7 and 8 with the goal of matching the gingival architecture of tooth number 9 and 10. This temporization period was also extended to ensure that the tissue that underwent the laser gingivectomy was allowed sufficient time to heal. It should be noted that external bleaching of a preparation has the potential to interfere with the bonding protocol of the final ceramic restoration, so it was important to provisionalize for an appropriate amount of time. Ultimately, keeping the patient in a Biotem provisional provided a durable solution for approximately 6 weeks. Final impression was taken. We can see that some of the underlying enamel was largely still intact. I delivered the final BruxZir Aesthetic restorations using Relink Aesthetic, a total etch system. I apply phosphoric acid gel to the enamel and allow it to react for 15 to 30 seconds. Rinsed and dried, followed by the G5 desensitizer. Then I coated the entire bonding surface using Adis Universal and light cured. I seated the units starting with the more distal restorations, the bicuspids, moving on to the centrals, then laterals, and lastly to the cuspids. After tack and cure, the excess was easily removed with an explorer. Like all other composite resin, Relink Aesthetic is subject to oxygen inhibition. To counteract this effect, I cover all the margins using glycerin gel like liquid strip. Then light cure again and rinse off. BruxZir Aesthetic provided a straightforward solution due to its precision fit, lifelike translucency, and long-term predictability. The overall appearance of the restorations met the patient's expectation, taking her from an unaesthetic dark shade to a very bright, bleached look. The overall durability of this new zirconia will provide the patient with a long-lasting and beautiful restorations. This patient was extremely pleased with the final outcome. Her smile was transformed and looked natural and bright. By utilizing a conservative approach as well as a versatile material such as BruxZir Esthetic, I addressed the function and cosmetic needs of this case. A beautiful smile was achieved that is attractive to the patient and clinician alike.
Well, thank you so much for that, Dr. Muresan. Your attention to detail is second to none.
Well, that wraps it up for today's episode of Chairside Live. So on behalf of everyone here at Global Dental, thank you so much for watching.
And we'll meet you right back here next time.